all of the COVID-19 patients as cases mount, but relief is on the way.
Yeah, CBS News' Kara Fincham is live this morning at County USC in Boyle Heights, where military doctors and nurses could arrive as early as today. Kara, good morning.
Good morning. The Department of Defense sending in that extra help. Not clear exactly when it will arrive, but we're told it should be in place by tomorrow.
The units are completely filled, actually. Any bed that opens up will generally be filled by most likely another COVID patient.
James Fiala is a veteran nurse in LA County USC's medical unit. He's relieved to hear 2 teams of 20 military staff are headed here and to Harbor UCLA. On the way, nurses, combat medics, and respiratory therapists. Fiala says on top of the ongoing record surge, many co-workers are getting sick, so the hospital is also scrambling to fill those positions.
People who I knew used to work on my unit 20 and 25 years ago that had been working desk jobs are now working with me side by side, now training again in the jobs that they used to do.
Over at Harbor UCLA Medical Center in Torrance, the chief nursing officer says the extra staff can't arrive soon enough. Their intensive care unit is running well over capacity.
We're running 150% occupancy in our ICU. We keep adding and adding, and we want the end to be near.
Yesterday, LA County as a whole hit a new record for both infections and hospitalizations. And overnight, more troubling news. Methodist Hospital of California in Arcadia sent a memo to staff saying they've now met the state's definition for crisis care. Hospital leaders say they have 233 patients with more than half COVID positive and in isolation. And as a result, some patients may now have their care options limited. Nurse Fiala is worried about sick friends and patients. So on his own, he's been studying common drugs that are widely available to help treat respiratory distress. He just wants to help and says it's getting harder every day. And he says the hospital has also canceled elective procedures that aren't considered essential. Suzanne, I also just spoke with another coworker here. She says she's saddened because some of these retired employees who have come back to help, they're now getting sick too.
Oh, no, and I'm sure in higher risk categories if they were retired. Thank you, Kara Fincham, reporting live. We're now getting a closer look at the crisis hospitals are facing. This is inside of Martin Luther King Jr. Community Hospital in South LA. Almost every ICU patient is on a ventilator. That is according to critical care physician Roger Christensen, who says he pronounced 4 patients dead just overnight.
These are younger, healthier patients who are dying. They may not be the picture of health, but certainly somebody who's walking around at 55 with diabetes is not expected to die from a viral pneumonia.
And this crisis inside hospitals is spilling out onto the curbs where ambulances and EMTs are forced to hold patients as hospitals look around for open beds. And what would normally be a 7 to 10 minute drive to a hospital is now taking 2 to 4 hours of wait time. EMTs have also been directed to conserve oxygen as resources are running critically low, DeMarco.
Well, Suzanne, we are seeing more vaccinations given out today. Healthcare workers and even some patients at an assisted living facility are getting